moving on to our next session now, which is a sort of introduction to the team and a bit about research advances. But the first area we're going to talk about is new staff. And one of the challenges is for us, particularly for me, has been, how to cope with the number of referrals we're getting for CADASIL. We're getting increasing referrals. I think it's getting more known about generally. More cases are being picked up. Perhaps people are finding out through the charity and other things about how they can get referred and seen with CADASIL. So this has led to a big build-up of patients, which is why some of the follow-ups particularly have been delayed. So I'm really pleased that we've got another doctor, another consultant neurologist who's working in the clinic now, who's Stefania Nannoni, who's been working at Cambridge for quite a number of years now. So Stefania can't be here today. She's in Italy today, but she's going to talk a little bit about things and tell you a bit about herself and so on. So, it's a great pleasure to let her do this. And so people coming to clinic may see one of two consultants now. They may see myself or they may see Stefania. So Stefania.
Hello, thank you.
Can you all, do you want to say something, Stefania?
Yes, hi, hello everyone. Can you hear me well?
We're just getting the sound, we're just getting the volume. We could hear you a bit too well, but we've turned it down for a moment. This should be perfect now.
Okay, can you hear me now? Can you?
Yeah, that's perfect.
Okay. So good afternoon, everyone. Thank you, Hugh, for this very kind introduction, and apologies for not attending in person the CADASIL meeting today. I hope that you can see me and hear me well, and we can have a nice talk, and there will be time for questions at the end of my presentation if you would like. So first of all, I would like to thank Professor Markus for the opportunity to introduce myself. My name is Stefania Nannoni. I'm one of the stroke consultants working in Addenbrooke's hospital, and I'm also working in research as a clinical research fellow attached to the stroke research group of the University of Cambridge. Just to give you a bit of my background, so I'm a neurologist. I've trained in Italy at the University of Florence. I've got a PhD in neuroscience, which was focused on the acute treatment for stroke, which I achieved in Switzerland, the University of Lausanne a few years ago. And then approximately 5 years ago, I joined the stroke medicine service in Cambridge, first as a research fellow at the University of Cambridge, and then started from 2023 as one of the stroke consultants working in the service in Addenbrooke's hospital. Since I joined Cambridge, my main research has been switched to small vessel disease, and I joined the stroke research group and collaborated to several studies that were ongoing in the department. I would like to mention one of our latest study, which is called Cambridge 7 Tesla Cerebral Small Vessel Disease Study, which is a study focused on the small vessel disease of the brain, which are the same that are affected in CADASIL. And we studied this vessel with a very sophisticated and very modern technology, a high-intensity brain MRI with a magnet called 7 Tesla magnet, which is very powerful and allows to see the small vessel in vivo. You can see a nice picture of the small vessel on the right part of the screen. We have some preliminary results about the patient that has been scanned with this sophisticated MRI, showing that patients that have a large number of vascular risk factors such as hypertension, smoking, or diabetes, and have features of small or so a shorter length of this vessel, and hopefully we can have a better understanding of this pathology in the general population. I I'm also done some research in CADASIL, and I would like to mention one of our latest research that I presented a few years ago at the European Stroke Organization Congress. We conducted a study in a large population from the UK Biobank, and we searched for the specific mutation of the Notch3 gene that are causing CADASIL, and we proved that these mutations are actually very much more common than expected in the general population. We also demonstrated that these mutations are not asymptomatic, are associated with some features of small vessel disease on the brain MRI, the same that we can see also in CADASIL patients. And so these results suggest that these mutations can also have a role in what we call the sporadic small vessel disease in the general population, and potentially some other genes can have an influence on how the disease is expressing. I would like to mention my role in the CADASIL clinic, as Professor Markus said earlier. So as many of you already know, the Cambridge CADASIL clinic has been run by Professor Markus for many years. Started from this year, I joined Professor Markus and started running my own clinics with my role to see patients, provide expert care, and support research. So you might ask, what does it mean for you? So I would like to start off with what stays the same. So you will continue to receive specialist care and advice during the clinic, and the clinic will remain a key center for CADASIL research. What's new is that a new consultant who is me, a new neurologist, had joined the clinic, and hopefully by this way we can offer you more appointments, and the aim is to reduce the waiting time either for the first visit, either for the follow-up appointment. I thought it was useful to summarize what to expect in a CADASIL clinic. So you will be seen either by Professor Markus or myself. The initial appointment is usually a face-to-face appointment in Addenbrooke's hospital, and there's also the possibility for generally for the follow-up appointment to have an appointment by telemedicine, so we can help you to set up a video call, which avoids you to come back to Cambridge to have your follow-up appointment done. Of course, what happens during a CADASIL visit will vary depend on the case. However, generally speaking, we collect your personal history, we collect your family history, we perform the neurological assessment, and we usually review the images of your MRI of the brain. We can ask for a new MRI if needed. You might be offered some cognitive test during the appointment, and the genetic test for the confirmation of the diagnosis if needed. You also might be asked to take part in our ongoing research. Even if this is optional, it will not affect your care in any case. So I would like to conclude showing my contact details, and to remind you that if you wish to be seen in the CADASIL clinic, you need a referral from your GP or from your local neurologist. You can refer your request directly to me, and these are also the contact details of my secretary, Kate Rose, who is also Professor Markus' secretary. And I think that's it. I'd like to thank you for your attention, and also for your interest and support in CADASIL.